Hello, I'm the Bio Guy, and it would really make my day if you would like and subscribe if you haven't done so already. Okay, let's now get to our medical mystery. In his first couple years of life, Sarah and Mark's baby Leo appeared perfectly healthy. He was a bouncy and bubbly little guy, but as he turned 3 years of age, his health began to suffer. It started with a slight cough that was occasionally accompanied by stridor, a high-pitched whistling sound. His parents hoped that Leo's symptoms were the result of a short-lived infection or allergy were dashed as the cough and stridor persisted. They brought Leo to their pediatrician, who listened to the boy's airways and pronounced that Leo had asthma. Asthma symptoms, which can include cough, wheezing, shortness of breath, and chest tightness, result from inflammation and narrowing of the airways. These symptoms can be exacerbated by exertion, pollen, and other allergens. Leo's pediatrician prescribed a rescue inhaler that contained albuterol, which binds receptors in smooth muscle, causing relaxation of the muscle and consequential dilation of the airways. For a short time, almost everything Mark and Sarah saw in Leo agreed with the diagnosis, but it wasn't asthma. A year into the family's ordeal, Sarah and Mark found themselves using the inhaler on Leo more frequently. The pediatrician, not reevaluating his diagnosis, prescribed a corticosteroid to reduce inflammation. But Leo continued to have attacks, and the family was spending an inordinate amount of time at the local urgent care. Poor Leo must have been in a near constant state of fear. When would he next find himself struggling to breathe? Entering kindergarten at age 5, Leo couldn't keep up with his classmates. He would tire out well before the others exhausted a fraction of their energy. And then a new symptom began to appear. Leo's lips and fingertips would take on a slight bluish coloration. This cyanosis was a stark indicator that the boy's oxygen saturation was well below where it should have been. While Sarah and Mark's concerns rose and doctor visits became more tense, every clinician remained consistent. This is asthma, and it is a challenge to manage. But it's easy to see Sarah looking up to her husband and hear her say, "Mark, this isn't asthma." That would soon be confirmed. Leo was playing tag, running hard when he grabbed his chest, wheezing like never before. His skin went pale and his lips and fingernails turned cyanotic. The rescue inhaler had no impact. So Sarah and Mark picked up Leo, ran to the car, and raced to the emergency room. There, despite aggressive treatment, Leon's oxygen saturation remained frighteningly low. The physician treating him thought his breath sounds were unusual for asthma, and she believed that she might have even heard a heart murmur. She ordered an immediate chest x-ray and EKG and called for a cardiology consultation. The pediatric cardiologist ordered an echocardiogram to view the heart, and it wasn't long before he knew that this was not asthma. What Leo had was a congenital deformity of the heart, and it was fixable. The pediatric cardiologist explained to Leo's parents that their boy had a vascular ring. One of his major blood vessels arising from the heart was pushing against his trachea, partially collapsing the airway. In effect, his heart was strangling him internally and had been for years. In the normal heart, the vessel that emerges from the left ventricle and extends cranially, that is towards the head, is the ascending aorta. The aorta then does a 180, where it is called the aortic arch, and then moves towards the feet as the descending aorta. Off of the aortic arch arise 3 major arteries: the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. There is one aortic arch, and it sits in front of or ventral to the trachea. In a vascular ring, the aortic arch or the vessels emerging from the aortic arch literally or effectively reach around the esophagus and or the trachea, presenting challenges to swallowing and or breathing. There are several types of vascular rings described as complete or incomplete. Let's take a look at one example of a complete vascular ring, specifically the one called the double aortic arch. To understand this anomaly, we have to take a look and see how the aorta normally develops. The cardiovascular system is the first system to develop in the developing embryo and fetus, The heart beginning its development only 22 or 23 days after fertilization. The heart extends 6 pairs of embryonic aortic arches. Normally, 3 pairs regress while the remaining 3 pairs form the single aortic arch and the other vessels. But if one of these embryonic aortic arches, specifically the 4th aortic arch, fails to regress, it forms a second aortic arch behind or posterior to the trachea and the esophagus. So in this condition, the trachea and esophagus are compressed between 2 aortic arches, one to the front and one to the back. Fortunately, a double aortic arch and other forms of vascular rings are operable, and the success rates are remarkably high. So high, in fact, that even in cases of asymptomatic vascular rings, surgery is indicated. Leo went through surgery and had a complete recovery. His symptoms were all resolved, and in time he caught up with his friends running around the playground and athletic fields. And as always, this video cannot and should not be considered medical advice. It is solely for entertainment and education purposes. Medical decisions can only be made between the patient, guardians, in consultation with trained medical professionals. Thank you for watching.